Hi, everyone. I'm Greg Caldwell, and I've been asked to give a brief presentation here on OCT wellness, and more than just wellness, because as you'll see here, it enhances patient care, your viewpoint to the patient and to the physician and the physicians in the community, and then it does bring some nice cash stability to the practice. So let's just jump into it here. I've been doing a wellness program for over 15 years. We started with Optos and the Optomap. And then we started with OCT wellness with the practice along with the Optomap. And I really had to fight with my partners to get that in because they were like, oh, our numbers are going to drop. And actually, our numbers went up significantly. So for a few years, we did an Optomap, a retina, and GCC. And then just recently, we added angiography into the practice. So here are the wellness scans, and you can see here that it starts with a B scan at the top here. It's not usually how I review it, but you can see a horizontal scan and a vertical scan. You have GCC. This is just a one eye scan, the left eye. You can see the GCC map, the GCC readings, a retinal thickness map, and then the horizontal and vertical B scans. This is typically how I look at them, as I look at them with the right eye and left eye B scans. We have the GCC, you have your color coding here, and you can see what's happening with the retina thickness map. And then what we do most in the practice are these Angio Wellness, where you have, and this is the order I usually go in, start with the GCC. It's a little bit thicker here than average, usually about 85 to 100. And that's what's making these retinal thickness maps a little bit thicker. But you can see here that the B scans look good, and then you get an angio. You can see how beautiful the blood vessels are. The nice thing about OptiView is they actually have ways that measure quantitatively, and you can see what's happening here, a little thicker on the nasal side and a little thinner on the temporal side. So this can be done. I like pointing this out. This is actually an old photo. I got to get a newer one in here because we do have a fifth doc in our practice. It started with this guy here. Then he added in Dr. Imler, and then with myself and my wife, and now we have a fifth doc. And we do have an ophthalmologist that comes in once a month, twice a month to take care of our patients for us. As you can see here, this is our staff, and then we have our own building, and we do electronic health records. We have an optical, we have contact lenses. So we have a nice broad bandwidth of medical and routine care in our practice. So if I can do it in Duncansville, Pennsylvania with a annual income of $42,500, again, I said it in the introduction here, it enhances patient care. It always starts with the patient care. Then you get the practice elevated from the patient point of view. Man, this is really cool technology. Then the medical community, the internist is really about the patient with diabetes. What are you saying to Johnny out there? How are you getting his hemoglobin A1C? Because we're finding these early vascular changes. And then the benefit is the cash flow and stability to the practice, because it's an all cash-based type of procedure. Here, real quick, 2019, we have 2.8 full-time equivalent. I showed you 4 docs there, and we added a fifth, but I traveled so much pre-COVID and my wife was part-time and the senior partner was part-time, that it's truly about 2.8 full-time equivalent. So you can see we did wellness scans of 2,355. Here's Optos and OptiView. We just added the OCTA really at the beginning of the year. We missed a few months, but you could see that the numbers were trending up. And this year, pretty much to 2020, you'd think wellness would be down, but I think the COVID has really got patients really focused on their healthcare. So the numbers have been up, and we've been back in full schedules for about 5 or 6 weeks now. And we're just doing majority of Optos, the wellness, and the OCTA. But you could see the amount of numbers that we can generate. You can see what we charge. In 2019, we generated about 137,000. Then you have the medical side. We did about 30,000. So if you think you're going to pay these instruments off with medical, yeah, you can do it, but you can really do great on the wellness side. Here's what we generated, and per doc, it's about $60,000 that we generated in a year. One nice feature I like, and this is what the technician sees, but I'm going to zoom in on it. I like what OptiView does with just having something solely dedicated for wellness. That's a nice little feature to have. OCT angiography, it's non-invasive. We're not using any dyes, and we're getting these great images of the blood vessels, superficial and deep, down to the outer retina where there should be no blood vessels, and the choriocapillaris is all white. Here are the B scans that you can see, and then superficial, deep, outer, and choriocapillaris, and what it looks like. Here's a patient with diabetes, and here's a patient that we would do a dilated fundus exam. Everything looked normal. However, when you look at the foveal avascular zone, you can see where it's dropping out. You can see some microaneurysms here. This is how the PCPs are saying, what are you doing over there, Greg? How are you getting Johnny lowers hemoglobin A1C? Well, we're showing his vascular changes and telling him it's happening in his brain and heart, and wherever there's capillaries, it's most likely happening in those conditions. So we don't want to have long-term effects. So get those blood sugars down. I love this slide because 2015, we rely on B scans and we'd say, hey, this all looks pretty good. Maybe something showing up there, and then definitely something showing up here. But look at the capillary density. Blue is bad. That means the capillary density is starting to drop. And you can even see here, again, why I love OptiView, 45 down to 39, down to 38. You can see the numbers decrease and the blue lakes are expanding. This patient is having diabetic retinopathy changes, and this is the micro changes, right? The optos is macro, this is micro. So here's again what it looks like, normal GCC, and then the retinal thickness map, B scans. I want to show you this patient with diabetes. The B scan looks great. The GCC looks great, but the foveal avascular zone, asymmetry is the key. Check out this one, 0.2, this one's 0.35. Look how this one's expanding. I'm gonna jump right over here. Look at the dropout, even some dropout out here. Capillary damage, that foveal avascular zone is expanding. One of the earliest signs of diabetic retinopathy. This patient needs to get their hemoglobin A1C under control. Another patient here, typical what we see, right? Little vitreomacular traction. You can see the impending PVD, another impending PVD going on. Jump down here. It's really the asymmetry. When it's about 0.1 or bigger, that's when I get concerned. And you can see this one's right at 0.1. Look at this 3.9. Look how this is starting to expand right here. And even the other eye here is starting to become a little bit ratty. So maybe it's expanding too. So the asymmetry is not as much, but the asymmetry is the key here. And you can see what's happening with these patients. Here's a patient with macular degeneration. You'd say, oh, well, it looks like I believe that there's probably something going on. But when you look at the angiogram, not at the superficial or deep, down where AMD occurs, down in this choriocapillaris area, look at this beautiful net, and you can get this patient over with confidence to make sure that they get their VEGF. So how do you implement wellness into your practice? Well, it starts with the staff and a lot of, I should say a lot of training, just some good training. We offer to everyone that has a comprehensive eye exam, not the patients that have medical, anyone that's coming in for a comprehensive eye exam. Front desk knows who those people are, and they know this script, which is right here. You can see the script, and here's where the patient walks in the door, so that's a reminder for them. And pretty much it goes something like this. The doctor wants you to have an Optomap and OCT, which are photos that are done today. You combine these photos with the exam, and you just get a really good imaging with the exam today. And the doctor will read over these forms with them carefully. Now, obviously, the front desk does a lot smoother than I just did. But the key here, the tips are, is make sure, you don't say, well, it's going to cost you $70. Do you really want to have this done? You don't really have to fill out those forms. We offer to everyone that comes in. We never judge the book by the cover. People get this, they love it. And it elevates the practice, and it's best patient care possible that's out there. Here are our forms that we use. I can always share them with you if need be. The benefits that our staff use, it's a complete image behind the eye. It's a larger view than the slit lamp. It's quick. It takes minutes. It's patient friendly. It's non-invasive, no pain, no drops. It's not a replacement for dilation, but to acquire the images doesn't require any drops. One of the analogy I use is it's like a driver's license. Every 4 years in Pennsylvania, we got to get one. And I take this one and that one and go, oh yeah, I did change in those 4 years. And I use that even in the office when I start showing year after year with the patients that's out there. So there's a lot of benefits, there's not always signs or symptoms with problems. Problems can be asymptomatic. So these are the benefits that the staff uses when doing this. So to recap, expand patient care and practice revenue with OCT angiography and these wellness programs. Again, it's all about the patient. You deliver better patient care. Again, it elevates you in front of your patient in the medical community, and then it brings in the cash flow. Patients with diabetes, glaucoma, ocular hypertensive, macular degeneration. This stuff works great for wellness and on the medical side. You educate your staff and your patients on OCT angiography, using vascular images in diagnosis and treatment and management of ocular disease has been amazing for the practice. So I would encourage everyone to look into OCT angiography. Again, I can't say enough. Here it is again. Patient care, practice point of view, patients, medical community, and the cash flow. I'll wrap up with this one. Check out these B scans down here. How many of you out there would have said, oh yeah, this patient has wet macular degeneration? They had a few other symptoms. I asked them to run the angiography. Look how early this is. The retinologist thought it was just amazing that we caught this early and we got this patient treated. You could see the photoreceptor integrity lines intact here, and the patient ended up maintaining great vision. Early detection. We haven't said enough of that out there, early detection. Well, thanks everyone. I hope you enjoyed this. And if you have any questions, please feel free to contact me. Thank you very much. Bye-bye now.